Hello viewers, welcome to the program. The population in Singapore is aging rapidly, and one common health condition related to old age is osteoporosis. Osteoporosis means porous bones. It is a condition where your bones become weak, brittle, and fracture more easily than normal bones.
Over the last 30 years in Singapore, the number of hip fractures has increased 5 times in women aged 50 and above and 1.5 times in men of the same age group. Studies have shown that 1 in every 5 people with osteoporotic hip fractures died within a year. Therefore, it is important to learn how to keep your bones strong and healthy.
What happens when you have osteoporosis?
Patients with osteoporosis are prone to bone fractures. The parts of our body which fractures commonly occur are the wrist, upper arm, ribs, spine, hip and pelvis. For the elderly, fractures may take a longer time to heal. In addition, their daily activities will be affected as well.
Osteoporosis is known as a silent disease because there is no telltale signs in the early stages of the condition.
Signs of osteoporosis at the later stage may include back muscle pain, especially around the lower back, loss of height with a stoop posture, otherwise known as the dowager's hump, frequent bone fractures from minor falls.
Why is screening important? Screening is important to help you detect osteoporosis early. One common screening test is the bone mineral density or BMD scan, which can assess the strength of your bones and detect the likelihood of you getting a fracture. It is a quick, painless and non-invasive procedure. The results will be analyzed and interpreted by a doctor who will then advise you on what to do next. If you are at risk of osteoporosis, the BMD scan is a very important screening tool for you.
You may be at risk of osteoporosis if you are above 65 years old and have a family history of osteoporosis, thin, have a small frame or very underweight, a woman who is going through or has gone through menopause, or have had your ovaries removed before the age of 45, have poor nutrition and do not take enough calcium, do not exercise regularly, smoke, drink too much alcohol, take steroids, diuretics or blood thinning medication for prolonged periods.
You can now get your BMD scan right at your doorstep with the NHGD mobile BMD container. In the NHGD mobile BMD container, a radiographer will be using a DEXA machine to scan the lower spine and the hip.
Spine and hip bone densitometry is the gold standard for the assessment of the bone mineral density and its susceptibility to fracture. Your results will then be compared to the local reference range, which is adopted by the restructured hospitals in Singapore.
What should you expect for your test? A bone mineral density screening might be something new to you and you might feel anxious. But do not worry, the whole procedure will only take 20 minutes.
Here are 5 easy steps for you to understand what you can expect on the day of your screening. Step 1. Registration. Please give your identification documents, IC or passport, to the coordinator. Step 2. Before the screening, the coordinator will help you complete a simple lifestyle questionnaire.
Your height and weight will be taken to calculate your body mass index or BMI. You will then be directed to change into an X-ray gown before the BMD screening procedure. Please wait for the radiographer to call your name before entering the X-ray procedure room.
Step 3. The radiographer will then explain to you the screening process. Step 4. Screening takes place in the X-ray room. Step 5. Once the data is successfully loaded, you can change back into your own clothes and leave. Please also remember the following conditions necessary for the screening. Please bring your identification card on the day of the test. No fasting is required. Do not take calcium supplements on the day of screening. Inform the staff if you had a nuclear bone scan in the past 72 hours or a barium study within the past 7 days. You will require a doctor's referral to take the BMD test. What is next after your screening? Your results will be known within 5 working days and it will be sent directly to the doctor who referred you. Your referring doctor will discuss the results at your next appointment and suggest the necessary medical treatment and lifestyle modifications. Previously, patients only discovered that they had osteoporosis after they fell and sustained a fracture. This led to much inconvenience and cost for both patients and their families. With an early BMD scan, we can now identify patients at risk of osteoporosis and take preventative measures to reduce their fracture risk. The NHGD mobile BMD container brings this service conveniently to your doorstep so that patients can get a BMD scan and understand their bone health.
The BMD procedure was very comfortable and absolutely painless. It was done at my doorstep of my workplace, which made it very convenient for me and many of my colleagues too.
Through the BMD screening, I found out I have healthy bones. It encourages me to continue with my active lifestyle and balanced diet.
The risk of osteoporosis increases with age. Although women are more prone, men can get osteoporosis too. Protect your bones before it is too late. I had my BMD done
On board NHGD Diagnostic
Mobile BMD.
Thank you.
So, make an appointment for your BMD scan today. If you'd like to make an appointment for your BMD scan on board our mobile BMD container, please call or email us. Thank you for watching and I would like to wish you the best of health.